Hello and welcome to the Senior Pet Life. If you're someone who truly loves your senior dog or cat and wants to protect them through every stage of their journey, you are in the right place. Before we dive into today's important message, please take a moment to subscribe to our channel. We are dedicated to bringing you vital information that can make a real difference in your pet's life. Now, let's talk about the silent symptoms that could be putting your beloved companion at risk without you even realizing it. As pets age, the visible signs of getting older are often easier to recognize. We notice the graying fur, the slower movements, the longer naps. But what we often miss are the subtle, almost invisible symptoms that signal deeper health issues developing under the surface. Senior dogs and cats are experts at hiding their pain, their discomfort, and their declining abilities. It is a survival instinct from their ancestral past, when showing weakness could mean danger. Today, in the safety of our homes, that instinct can tragically work against them. It can cause life-threatening conditions to go unnoticed until it's too late. That is why today, we're going to open your eyes to the hidden signs you must watch for if you want to truly protect your senior pet. One of the first silent symptoms is subtle changes in breathing. Maybe you notice your dog panting a little more after a short walk. Maybe your cat seems to breathe heavier when resting. Most people dismiss this as normal aging, but it can be an early sign of heart disease, lung problems, or respiratory distress. Breathing should always be smooth and effortless at rest. Shallow, rapid, or labored breathing, even if mild, is a red flag that needs immediate veterinary attention. Another hidden warning sign is intermittent coughing or gagging. A single cough now and then may seem harmless, but if your pet develops a pattern, even if it is subtle, it could point to serious conditions like congestive heart failure, tracheal collapse, or chronic bronchitis. Cats, in particular, are often misdiagnosed because they suppress symptoms so well. If you hear coughing, wheezing, or notice your pet clearing their throat more than usual, it is time to investigate. Loss of muscle mass is another silent symptom, often mistaken for simple aging. You might notice that your dog's hind legs look thinner, or that your cat's shoulders seem more pronounced. This is not just a natural course of life. It can indicate chronic disease, poor nutrition absorption, arthritis, pain-limiting movement, or even cancer. Muscle wasting can drastically reduce a pet's quality of life and longevity if not addressed early. Regular body condition checks and muscle assessments can catch these changes before they become critical. Changes in behavior are a powerful but often overlooked symptom. Your outgoing dog becomes withdrawn. Your independent cat suddenly becomes clingy. Your normally affectionate pet starts avoiding touch. These shifts are not just emotional. They can be the earliest signs of pain, cognitive decline, sensory loss, or systemic illness. Senior pets communicate with their behavior. Ignoring changes can mean ignoring cries for help. Another symptom hidden in plain sight is changes in posture and stance. A dog who starts standing with their front legs wider apart. A cat who hunches slightly when sitting. A pet who suddenly sits down more frequently during walks. These are signs. They are compensating for discomfort, instability, or weakness. Even slight posture changes can reveal arthritis, spinal problems, neurological disease, or internal organ stress. Watching how your pet carries their body is as important as watching how they walk. Subtle eye changes also carry silent warnings. Cloudiness, excessive tearing, redness, or slight bulging can indicate cataracts, glaucoma, hypertension, or systemic diseases like diabetes. Many eye conditions can be managed if caught early, but can lead to irreversible blindness if ignored. Regularly checking your senior pet's eyes for clarity, brightness, and normal pupil responses can catch problems before they escalate. Changes in routine bathroom habits often whisper before they scream. Increased urination, straining to defecate, accidents inside the house, or changes in stool consistency are signs that the kidneys, bladder, intestines, or hormonal systems might be under strain. Senior pets are particularly vulnerable to urinary tract infections, kidney disease, and diabetes, all which can start with minor, barely noticeable symptoms. Oral health is another hidden battlefield. You may not notice bad breath or slight reluctance to chew at first, but dental disease can cause severe pain, lead to infections that spread to vital organs, and drastically shorten your pet's life. Senior pets often need more frequent dental care, and even small signs like chewing on one side, drooling, or pawing at the mouth deserve immediate attention. Another silent threat lies in appetite and drinking patterns. A pet who suddenly becomes picky, eats slower, or drinks a bit more water could be developing serious internal issues. We often overlook gradual changes in eating and drinking, but they are some of the most powerful early indicators of systemic disease. Senior pets need consistent, balanced nutrition and monitoring of their hydration status more than ever. Neurological changes can also whisper before they roar. A slight head tilt, walking in circles, occasional disorientation, or minor tremors can all be early signs of neurological disorders, brain tumors, or vestibular disease. Early intervention can sometimes slow progression, manage symptoms, and vastly improve quality of life. Sleep pattern changes are another silent symptom. A senior dog or cat that suddenly becomes restless at night, who wakes up panting, pacing, or vocalizing, may be experiencing pain, cognitive dysfunction, or metabolic imbalances. Monitoring sleep behaviors and providing a stable, quiet sleep environment can not only improve comfort, but also signal when deeper issues need to be addressed. Even subtle emotional changes are clues. A once confident dog who becomes easily startled. A cat who hides more often or hesitates before jumping up to familiar places. These changes are not random. They are your pet's way of adapting to sensory loss, pain, cognitive changes, or general frailty. Listening to their emotional shifts is as important as monitoring their physical body. The common thread among all these silent symptoms is that they are easy to miss if you are not looking for them. Senior pets are stoic. They suffer in silence because they do not want to show weakness. That is why it is up to us, their guardians, to become fluent in the language of subtlety, to notice the small shifts, to care enough to question what we see, to act before a whisper becomes a scream. Regular veterinary checkups, even when your pet seems fine, are essential. Blood work, urine analysis, dental exams, and physical evaluations can catch problems early when they are most treatable. Weight tracking, behavior logs, and environmental adjustments at home can make senior years not just longer, but happier and healthier. Caring for a senior pet requires vigilance, empathy, and a deep commitment to honoring their silent battles. They have given you a lifetime of loyalty, love, and companionship. They deserve a lifetime of attentive, proactive care in return. Thank you for being the kind of person who chooses to learn, to listen, and to act on behalf of the ones who cannot speak for themselves. Your pet may not have the words, but their gratitude is written in every wag, every purr, every look of trust. If you found this information valuable and want to continue learning how to best care for your senior dog or cat, please subscribe to The Senior Pet Life. Give this video a like to support our mission of honoring senior pets everywhere, and leave a comment sharing your story. We would love to hear about the incredible seniors who make your life brighter every single day.